hospital members and others to help decide how do we address some of the healthcare needs and disparities across our state in different locations. So that's where some of the funds. So from a how do we work with our government perspective, we had a very good working relationship to get this accomplished. Our state wanted it accomplished because they wanted those federal funds. And so it was a lot of work to get it done, but it did happen. So that's just something that happened this year from a legislative perspective. So then I'm going to skip to a couple other state laws that are impacting healthcare, not necessarily, again, related to the Affordable Care Act. So some of these include we have to have physicians certify an ambulance transfer, and the documents and how that's all done, there's new laws that we have to comply with from that. There is the Sexual Assault Nurse Examiner Bill. This bill actually goes into effect, it says January 2020, but it actually goes into effect 20 of 19 that we have to have a plan in place, and then by 2022 we have to have enacted the plan. Basically, if a person comes to our emergency room with a potential sexual assault, we have to have a person who's specifically trained as a sexual assault nurse examiner to be available to that person within 90 minutes, and if not, we have to be able to transfer that patient to a facility who does. So that's a new law that's coming to effect. It's important from a care perspective, but from a implementation perspective, it is very challenging for rural areas to be able to have sufficient number of people trained to be able to meet that need, especially based on the percentage of people that we actually see come in.
Just to interrupt you, a couple questions. Does Illinois have the problem with unprocessed rape kits that, like, Wisconsin had thousands of them, Texas had tens of thousands that were never?
I have not heard, but I would presume that that's a problem in one place. It might potentially be in another place, but I don't know that that's the case.
And is it slightly off topic, but is it a practice to ask pretty much every woman that comes into the emergency rooms some questions that might?
We are required to ask screening questions for potential abuse.
Right.
Mm-hmm.
Okay.
Yeah. So another, and there's the Healthcare Violence and Protection Act. If you follow the news again, from a healthcare perspective, there was an attack in one of the suburbs in a hospital where a jail inmate was receiving care and attacked nurse, etc. So as a result of that, our legislators have put in Healthcare Violence Protection Act, so we have additional security measures and stuff that we have to enact in order to protect our employees. So again, just things, not saying they're good or bad bills, or just bills that are out there. In addition, we have in the state of Illinois what's called Certificate of Need. Basically, this means that if I want to build a new hospital, I have to put an application out to the Certificate of Need, Health Planning Board, I don't know what the name is, the Health Planning Board, and ask for permission to build that hospital. And they would be looking at what's the population, what's the available resources, etc., to determine whether or not they would approve that. That same thing is for a certain amount of additions to your hospital, certain things like that. You actually have to ask the state for that permission. And the Certificate of Need bill was due to expire in December of 2019, and he voted, he vetoed the bill that was out there. So this basically, we still have what's called Certificate of Need process in the state.
Wouldn't apply to something like if you decided to put in another prompt care somewhere?
If my bill is less than $12 million, it does not apply. All right, so another law that our state put in is related to Medicaid telehealth services. I mentioned when I was talking about some of the federal stuff, is that Medicaid in Illinois did not pay for telehealth. And so one of our newest laws will allow for mental health professionals to actually be able to receive pay for taking care of someone via telehealth. We're very excited to have this as an approved law. Again, not only does the legislators affect us, but decisions that happen in the courts affect us as well. This started actually with legislation. Again, hospitals as tax-exempt organizations do not pay property tax. That's been challenged a couple of times in a couple of different counties, different areas in our state. And that has gone all the way through the Illinois Supreme Court and has at this point said that we can maintain tax, not pay property tax as tax exempt organizations. The legislation that was put in place actually did define how much for, charity and financial assistance we need to provide in order to maintain that status. So may not be done. There may be more cases coming forward, but it's been through the court several times now. So I also want to mention grants a little bit, because these are often come out based on legislation that happens. So the Illinois Department of Public Health has a chronic disease and school health grant, which ended in June. But this was able to provide education on diabetes, sodium reduction, blood pressure, etc. We did receive this grant last year for our sodium reduction program. So not only do we, see regular type of things that additional funding sometimes come out of different regulations. So I just, again, wanted to bring that up as the topic is something. So, okay, now I'm going to go back to the Medicaid expansion, because the ACA is what drove Medicaid expansion, but it really gets implemented in your state. Your state could choose to do it or not do it. Illinois did choose to expand Medicaid when that was started through the ACA. And part of the incentive to the state for doing it is for the first several years, federal government was paying for that expansion cost. And then after a while, it would go back to the states. So that was because of the ACA. What we saw across is that because of the Medicaid expansion, uninsured in rural areas decreased by 3 times in states that expanded the Medicaid program. Illinois' uninsured dropped from 29% to 12% in rural areas. So again, that's a high area of benefit that we got from the ACA. Specifically in Bureau County, 38% of children are covered through Medicaid and 19% of adults are covered through Medicaid.
But you still, in your report, wasn't the hit like $1 million and $2 million?
So, as I mentioned before, we do not make a profit on Medicaid. We actually lose money on Medicaid. The benefit that we see in Medicaid is that people who are uninsured do not access primary care.
Right.
When they don't access primary care, they end up in the emergency room or they end up very sick, and they are more costly to take care of, and we're going to take care of them anyway. So when a person has Medicaid, they do access primary care. And that gives us an opportunity to keep them healthier or identify things when they're less costly to take care of than if they're not receiving care.
So, but you took the, say, $3 million hit on Medicaid and Medicare. How much in straight charity? I mean, there are very sick people who come to you all the time with nothing.
And that decreased significantly because of the Medicaid expansion. And we still have it. We still are giving charity care or financial assistance out. But because of that expansion, and we actually are seeing way less people who don't have something because we have Medicaid as what they have.
So that's kind of better.
It's kind of better. And the other aspect of it, and this is why I wanted to conclude this, is the National Bureau of Economic Research shows that Medicaid expansion was associated with a reduction of unpaid medical bills by $3.4 billion.
Huh.
It's also showed that is associated with improved credit scores and reduction in new delinquencies of those people who got on Medicaid. So now think about it from an economic perspective in your community. If these people are on Medicaid and they now have health coverage and they're getting their primary care and they're no longer being delinquent and being bankrupt, isn't that better for our economy as a whole?
So somebody can come in with nothing and apply and get Medicaid starting from the time they come into the hospital?
Actually, they can apply for Medicaid and get it post-approved. So if they came in and didn't have it applied and were eligible, it can actually be retroactive.
Mm. That's good.
Yeah. Okay. So, again, how is Medicaid being used? The Healthcare Cost Utilization Project released a statistical brief on this. Pediatric emergency department visits in 2015, the data showed that there were 30 million ED visits for children 18 years old and younger, with Medicaid as the payer for more than 60% of those visits. Let's look at the reason they're going. Respiratory disorders, injury, and poisoning. again, getting people into primary care, because asthma is one of the big reasons that children end up in the ED. We can help manage it, and that's one of the things we're trying to do more with chronic care management and other type of care with the primary care side, is to help people to manage and know how to manage that type of respiratory disorder without ending up in the ED. So it is actually allowing us to do better, but this is where we were at this point, is that 60% of those visits were Medicaid was the payer. And again, those were the reasons. So again, what we're hearing from the federal government side, and we've seen a couple of states enact this, is Medicaid work requirements. So how they got to do that is part of the Affordable Care Act created what's called waivers, waiver 1115 waiver. And so each state could apply to the federal government to say, we want to use our dollars a little bit differently, and this is how we want to use them. So part of that, in some states, they chose to include work requirements for Medicaid recipients. The state of Illinois did not choose that. The state of Illinois actually chose to do a waiver request that is going to allow for better mental health coverage. So I'm actually pretty excited about the waiver that the Illinois applied for. But let's go back. That one, okay. That's the one I really want to show you. So again, going back to the Kaiser Family Foundation and what they've got to say about Medicaid recipients. This big section here, 42% of people on Medicaid are working full time. These are our working poor whose income is not enough to afford a private plan or is self-insured or self-employed. So they're working people. 42% of people on Medicaid. So making a work requirement is not going to affect them because they're already working. The next 18% work part-time. So the first 42% is working full-time. The second section's working part-time. So these are people that are actually already working. The 14% here, these are not working because they're have an illness or disability. They're not going to be able to work. The purple 6%, that's people that are not working currently because they're going to school. So they're furthering their education and using Medicaid to support them while they're doing that. The next 12%, these are people who are giving care to others. They're not able to work because they're the primary caregiver. And then we have the 7% that are for other reasons. So going to a Medicaid requirement for work, it may not be as beneficial as it just sounds out of the box. All right, so what we want to focus on with all this legislation, working with this, is how do we help hospitals improve quality? Is the Affordable Care Act doing that for us? There's some pieces in it that require us to reach certain quality measures. We want to make sure that we have considerations for how we continue to provide rural health care. We think that collaboration amongst hospitals is extremely important. We want to look for workforce strategies for rural hospitals. One of the things that rural hospitals are struggling with right now is staffing. So we've always had, it's always been a challenge for rural areas to have providers, physicians, nurse practitioners, etc. But we go through times where right now nursing shortage is getting up there again. Medical technologist shortage is coming up again. So we're constantly struggling in how do we get the workforce we need to be able to provide the care we're doing as well. So always looking for workforce strategies. We want to be able to have stability. It's really hard when you have a negative margin many years. What's the stability of healthcare in your community if that's happening? So we want to be looking forward to that. We want always ongoing education and advocacy. So in the state of Illinois, the people who are up for election right now are Ryan Spain and Daniel Swanson. Neither one are, they're both running unopposed. So that's what I have to say about that. I really haven't heard either one come out on anything. I mean, I've heard a lot of political ads and I've not heard anything from either one, but I assume that's because they're unopposed and they're going to just be quiet. So.
Well, I mean, Swanson's in town all the time.
Yeah, I'm not saying he's not out and talking. I'm just not hearing a lot of what they're advocating for.
Might be worth our talking to him altogether.
So from the governor's race, though, we do have Bruce Rauner, our incumbent, and we have J.B. Pritzker. Last, he was leading the polls. That could continue to decline. We don't know as we get closer. But this is shaping up to be the most expensive governor's race. We have two very high income people. I think one of them had 53 million and the other one had 55 million income last year. Something like that, pretty close anyway. So I think that maybe if they would take some of that and help us out with our Medicaid patients.
It's just their annual income.
Yeah, that was annual income, yeah. So, but if Princeton wins, we're going to have potential for graduated income tax referendum on the ballot. He's looking at other service taxes, minimum wage bill, Medicaid as a public option, and then also that both sides are talking about some kind of capital plan for the state. Again, I told you I'm not the expert, but I tried to bring forward a lot of things that are happening in healthcare, both legislation, judicially, and et cetera, so you can have some idea. And like I said, there's not a lot from what we're hearing from the people running other than Adam Kinzinger and Sarah Davey.
What would be the easiest, best thing to happen for Perry Memorial Hospital?
Easiest, best thing to happen. So I tell you really what I would love to see happen. So this is something I did not talk about tonight, but, and this is something I should have probably talked about. Critical access hospitals are paid from Medicare 101% of their Medicare allowable costs. They used to be. When the couple administrations ago, there was a thing called sequestration. Does everybody know what that is? So they did an automatic 2% cut off what they owe people. So you're going from 101% of your cost, what's minus 2%? We're now getting paid 99% of our cost. So we are so critical access hospital designations were created to keep rural hospitals alive in rural communities. That's why it was created. So now we went from that 101% down to 99. So that's again why a lot of rural hospitals are being challenged. So my number one thing would be to get sequestration gone.
When did that happen?
I think it was during George W.
Yeah.
George W. Yes. So but it was based on the federal deficit. It's based on whatever the percent of federal deficit is. So right now, if we get to a certain another federal deficit level, sequestration will go to 4%. And the tax law from last year is leading us to that next level.
Yes, it sure is.
Yes. So that's my number one thing. I would want sequestration to go away for us because I'm guaranteed to lose money. No matter what I do, I am guaranteed to lose money.
Do you know if that was a party line vote at the time?
I don't really know for sure what it was. Obviously, the tax break this time was a party line break.
Oh, yes.
But I'm not sure when they did the sequestration, how that broke out. I would presume it was, but I don't know.
Pretty close.
Yeah.
I didn't hear anything at all about, my big concern is prescription drug costs.
Yes. So speaking of that, one of the things that the federal government believes is that if we have better price transparency, that will help. So one of the things they're proposing right now is requiring any ads from drug companies to state their price.
I've heard that.
So that's a possibility for that. The other thing is they actually, and I consider this a good thing that they did, and again, I didn't get everything in here because there's lots of stuff happening, but there used to be a pharmacy gag rule that if your plan had for prescription drugs was for this price,
I saw that
but
in the
you could
news
get
the
a
other day.
generic for $10 versus $4. If your pharmacist was not allowed to advise you of that, that was a gag rule, that has been taken away. So that's a positive thing that's happened. So again,
Is that immediately effective, or is that?
yeah, that's effective.
Well, I thought I heard that there was some partial thing,
No, that's
Okay.
that's in place. And then
I'm a diabetic, and I'm one of those who's been rationing his insulin. I've been cutting my doses because I can't afford it. You know, and I have insurance.
yeah.
So I'm just,
So,
something's gotta
yeah,
change.
so some of the stuff, they were talking about is how do we get to generics quicker? How do we, they're trying to figure out if there's ways. I think I don't know what kind of legislation or actual work we're gonna get, because we talk about the American Hospital Association as a lobby. The pharmacy lobby is very, very strong. Very, very strong.
How do you think CVS and Aetna is going to affect you?
You know, here in Princeton, Illinois, in the next 5 years, probably not at all.
Also
However,
get rid of the independent pharmacies.
However, we are seeing some very interesting mergers and changes throughout healthcare that we call these disruptors. There's a lot of stuff happening. So one of the things is Amazon. Amazon is getting into healthcare, and what they do to the book company. I mean, they're coming with devices that you can wear that will replace certain things, and some of it's good stuff, but how is that going to affect healthcare, and how is that going to affect my ability to keep an emergency room open in your community? So lots of stuff's going to be happening with that, but I think that kind of a merger is going not affect us as much as maybe in some of the bigger locations for now.
I'm not surprised, but that's the first I heard of Amazon being going into healthcare. Wow. And how long has this been afoot?
Oh, I'm sure it's been afoot for a while.
Well, I mean, to
Officially.
anyone's knowledge.
Yeah, oh, well.
Last few months? Wow.
So they, you guys in the back might be able to help me out here. Who else is with them that's just hired,
Until going to.
yeah, Rwanda? Who is with them that hired him? So they're actually trying to figure out with their own employees how to do incentives and stuff. So they're bringing their own primary care within their Amazon.
Berkshire Hathaway.
Yeah.
Um,
Yeah. So they're all.
Yeah, JP Morgan, just JP Morgan.
Morgan, I think it's the three, they're,
Yeah.
you know, they're talking 100,000 employees
Yeah.
or something.
Yeah, and so they're gonna be managing their healthcare within their organization rather than working with an insurance company.
Yeah, that's a good sign, I think. The rest of it is a little scary because it takes money out of, I mean, any way that they expand, the way Amazon tends to expand, takes money out of local communities.
Sure. So, I mean, I'm for ideas that help to reduce the cost of healthcare. If we can figure out ways to keep people more, healthy, I'm not opposing any of that kind of stuff. It's just we always have to be looking at how does it affect us, and then from a real healthcare perspective, we're definitely different than the Chicago area. They're going to have a different impact than what we are. We are challenged in different ways, and so just always have to be looking at how's that impacting us. Like I said, I'm not the expert on everything, but I hope I shared some information that was useful for you tonight.
Surely very well versed.
And didn't totally confuse you.
So do you think Perry's gonna hang in there?
Well, I hope that we will continue to provide excellent health care to this community going forward.
No. That's tremendous pressure, though. I think we all recognize that.
Well, I appreciate that people recognize that. Because we do need to, be aware and think about how do we continue to provide that care to our community, and it's not going to be Perry standing alone. It's going to be the community working together. It's going to be us being willing to work with partners. And that's one thing when you talk about this Aetna, CVS merger, et cetera. Nobody is doing it alone. That needs to be my message. Nobody is doing it alone, and we need to remember that.
It just occurs to me that because of relatively lower populous states have influence that's disproportionate to their numbers, because every state has 2 senators, that they would have to be very careful with rural health care.
That's an advantage. I mean, obviously you have to have the House and the Senate agree to things, so that's true. I think there is between the National Rural Health Association, et cetera, there is a lot. We are constantly reminding them as you're making these decisions, let's think about how this is impacting healthcare. And I do think we get that. We hear a response to that. It's just that not everybody that's making decisions understands rural healthcare either.
Way back at the beginning, the 3rd or 4th slide that was up there talked about the need to expand the marketplace for the Affordable Care Act or something like that. And they just did away with the individual mandate this last year. I mean,
So,
the
so
cognitive
the
dissonance
individual
there is-
mandate itself did not go away. the penalty
Oh,
for the individual mandate went away.
so, in effect,
Altogether?
same thing.
Through the tax
Okay.
law, there is no longer a penalty
Okay.
for it,
So you just go and say you're sorry, that's a.
Yeah.
So how do you expect to grow the marketplace when you do stuff like that?
Well,
That's probably an intentional act
yes.
then.
Oh,
Madness.
Thank you so much for being here with us.
yeah, that's great.
So much